good? Thank you. Good morning, everyone. Boy, the sun really warmed it up. It's so wonderful to go out this morning. It's freezing, which I kind of like. And then got here and I just was going to take my jacket off. This is wonderful. So thank you, Macungie, for greeting us with this great weather. So I am Brian Nestor. I am the President and CEO of Lehigh Valley Health Network, and this is a really big day for us. So I thank everyone for joining us. I'd like to begin by extending a warm welcome to a few people. Certainly the citizens of the Macungie area, but also my colleagues from LVHN, and also physicians from this community, and of course all of our elected officials. So we thank you for taking some time to come out here and hear a little bit more about this fabulous project. Today we're gathered at the former site of Weis Markets, and we thank them in their partnership to help us bring a new medical facility alive here on this property, which is expansive. It's going to be fantastic. And we want to thank the partners who helped us get here. All right, we have Embry Group, Boyle Construction, the Hereford Julie Architects. Give them a round of applause. We've been working a long time on this, and this is finally exciting to finally be here. So we appreciate all your help. We know you'll carry us through and to the finish line. So thanks. And we also want to thank the media. We have a few special guests that I'd like to welcome here as well. Today we have with us representing U.S. Congressman Susan Wild, Selena Winchester. Thank you, Selena. Also from Lower Macungie Township Board of Commissioners, we have Maury Robert. Maury will have a couple comments for us too in a little bit. We also want to always thank our trustees who sit in the background and support our network, and we thank them for all their support on this fabulous project. And we also have with us from the East Penn School District, Director of Student Services, Dr. Tom Mirabella. Tom, here. There, thank you. So LVHN is already very familiar, a familiar name in this community when it comes to great care. We've been nearby on Village Lane in Macungie, providing urgent care at our Express Care location and primary care at our LVPG family medicine practice there. Not far away, of course, you can always access higher level quaternary care at Lehigh Valley Hospital, Cedar Crest, which also has on its campus the Lehigh Valley Riley Children's Hospital. So through the decades, LVHN has been here serving this community, and we're thrilled to bring the care to another level. As the region's premier healthcare partner, we know those who want the best, we know those that we serve want the very best clinical outcomes they can have, but they'd also like it to be convenient. They'd like it to be nearby. They don't want to have to go and access care at a gigantic maze and try and find your way around. So we're here today to start a new chapter for Lehigh Valley Health Network and break ground on a new style of healthcare campus to bring leading-edge medical care closer to where the citizens work and play. And that's right here in the Macungie area, and we're thrilled about it. Today we're excited to announce, therefore, the construction of Lehigh Valley Health Network's first neighborhood hospital, Lehigh Valley Hospital, Macungie. Now, this is not only our first neighborhood hospital, the first one for LVHN. There will be others, but it's also the first in eastern Pennsylvania. Our campus here also will include a multi-story health center to be called Health Center at Macungie. Lehigh Valley Hospital Macungie is an example of our continued efforts to find more effective ways to meet our community's needs closer to home. So we are committed to providing world-class care that isn't a world away. That's my only pun for the day. Now I'd like to introduce Jim Miller, Chief Operating Officer for Lehigh Valley Hospital Cedar Crest and the 17th Street campus, as well as our Senior Vice President for Perioperative Services at LVHN. He will describe what is going to rise up on this site. Jim?
Thank you, Dr. Nestor, and hello, everyone. These are exciting times at LVHN and for the communities that we serve. So what will Lehigh Valley Hospital Macungie look like? What makes this neighborhood hospital different than other LVHN hospitals, and how will it deliver for our community? LVH Macungie will be a licensed and accredited acute care hospital, open 24 hours a day, 7 days a week, housed in a state-of-the-art facility. At about 22,000 square feet, it is a streamlined hospital featuring a full-service emergency room with 11 beds. In addition to the emergency room, there will be 10 inpatient beds. The inpatient beds are for those requiring overnight hospital stays or for additional care, observation, and testing. Someone arriving at LVH Macungie with more acute medical problems or requiring surgery would be stabilized and transported to a larger LVHN hospital with increased care capability. Pediatric patients requiring inpatient stays will routinely be transferred to Lehigh Valley Riley Children's Hospital. Lehigh Valley Hospital Macungie is a standalone hospital, but it's clinically connected to the larger health network for those needing advanced care. It will feature a welcoming environment and be equipped to treat and stabilize any condition. It fills a need by creating a healthcare option not currently available in this region. More capability than an express care, with experience and expertise to treat the same cases that would traditionally be treated and released at a larger hospital, such as Lehigh Valley Hospital, Cedar Crest. The majority of cases seen at all hospital emergency rooms are the treat and release variety. We hope that this new hospital will be open by the end of next year, barring any schedule delays due to weather or other factors. Most importantly, patients will receive the same high-quality, compassionate care and exceptional patient experience that you've become accustomed to expect from LVHN. I'll now turn the program over to Dr. David Burmeister, Chair, Hospital and Emergency Medicine at LVHN, to provide particulars of what will be offered at both LVH Macungie and the Health Center at Macungie.
Good morning, everyone. Thank you for being here to celebrate this really extremely important event. So thanks, Jim, and good morning, everyone, again. As Jim mentioned, LVH Macungie will be about 22,000 square feet. It's going to have 11 ER beds, and it's going to have 10 inpatient beds. Hospital services will include lab, imaging, and pharmacy, like any type of hospital would give us. Imaging services include X-ray, ultrasound, CT scan, and MRI. It's going to be offered in the emergency department, the inpatient units, and as an outpatient service to our community. Shorter emergency department wait times, faster inpatient admissions, and reduced length of stay are three key advantages of the neighborhood hospital model. The Health Center at Macungie, you can see a picture here, will be located directly adjacent to the neighborhood hospital and will be a 30,000 square foot, 3-story building housing services to meet a wide variety of medical needs. It will include H&L Lab Medicine and Lehigh Valley Physician Group practices covering family medicine, orthopedics, cardiology, and pediatrics. In addition, there will be an adult outpatient rehabilitation and cardiac and vascular diagnostic testing. Whether an emergency at the hospital or a routine medical visit at the health center, all of us are committed to making your experience exceptional. We deliver on that promise, and you should expect no less. Our team is genuinely dedicated to LVHN's mission to heal, comfort, and care for the people of our community. That dedication continues at LVH Macungie. Thank you all for your time and support of LVHN. I'll now turn it back to Dr. Nestor, and thank you again.
Thanks very much, Jim. Thank you very much, David. That was a great overview of the comprehensive services that will be here, serving thousands of people each year here in the Macungie region. So thank you. Yeah, pretty exciting. I'd now like to invite up for a few comments Maury Robert. Maury is on the Lower Macungie Township Board of Commissioners, and spoke with him briefly before this, and apparently they're excited about this project too. So we are very pleased with that. Please welcome up here Maury Roberts.
It's a pleasure to be here today to welcome Lehigh Valley Health Network and bringing another facility to Lower Macungie Township. On behalf of the township, I have a proclamation. Whereas Lehigh Valley Health Network submitted a land development plan in 2021 to Lower Macungie Township to develop the property located at 3369 Route 100, which was previously a Weis Market, and whereas LVHN project team worked diligently with Lower Macungie Township Planning Department to create a land development with top quality, aesthetically appealing facilities, and whereas after much planning and public participation, LVHN is proud to break ground for the first neighborhood hospital in the Lehigh Valley and a medical office building that will have a continued focus on their mission to heal, comfort, and care for the people of the community. Now, therefore, the Lower Macungie Township Board of Commissioners celebrate with Lehigh Valley Health Network at the groundbreaking ceremony for a new medical campus in Lower Macungie Township and wish them all the best for continued success. So, thank you very much for bringing the first neighborhood hospital to our neighborhood.
What great comments, and thank you for that wonderful welcome. Appreciate it. One quick comment, some people still have questions about neighborhood hospital or these micro hospitals. It's all part of LVHN's ongoing effort to deliver high quality care at a lower cost that is more convenient to the people we serve. An example of that and why this is such a big day for us, we've been looking forward to this type of delivery facility for a long time. About 8 years ago, we started moving acute care, hospital level emergency department patients to a cheaper, if you will, alternative setting. And you know that as LVHN Express Care. Those Express Care locations are almost at 30 across the region and now see more patients than all of our emergency departments combined. Pretty cool. Lower care, lower cost, high quality care in your neighborhood. The expression of this neighborhood hospital is along those exact same lines, delivering value to the communities that we serve. So with that, I'd like to welcome everyone up here who's been important to this project for our groundbreaking. We're finally at that moment, so those involved, please come on up. And while they're making their way up to the front, no one's coming up? I'm not worried. Yeah? Oh, there we are. Okay. Just need a second invite, that's all. And when we're done, we invite everyone to hang around and grab some refreshments and chat. So thank you for joining us.
See, we rehearsed this. All right, Alex. Contact.